Welcome to HSS Presents, the podcast of Hospital for Special Surgery.
Welcome to HSS Presents, the podcast for Hospital for Special Surgery. Our podcast explores the intersection of science, treatment, and wellness related to musculoskeletal patient care and orthopedics. I'm Stephanie Chen, and I'm going to be your host for today's episode. I'm a board-certified anesthesiologist that specializes in regional anesthesia, but I'm also fortunate enough to be trained and board-certified in medical acupuncture. I specialize in the integration of non-pharmacologic and novel modalities in the perioperative period for orthopedic surgeries. With me here are two HSS surgeons, Dr. Michael Ast, our Chief Medical Innovation Officer, who focuses on complex and revision total joint replacement, and Dr. Elizabeth Gausden, who's dual fellowshipped and specializes in adult lower extremity reconstructive surgery and orthopedic trauma. Today, we're going to have a discussion on acupuncture in the perioperative setting. So let's get started. Thank you both so much for joining me to discuss this exciting topic. Mike, you and I started this program about 5 years ago in 2018. And, we had both just returned from HSS, or rather returned to HSS as attendings after working elsewhere for a couple of years. And, I knew I wanted to start an integrative medicine program with an emphasis on acupuncture. Basically capitalize on the fact that I knew you were against opioids in general. So I asked you, hey, are you interested in trying this for your patients? And you were so gracious, said, of course, anything that will help decrease opioids, I am for trying. So do you remember our first patient? This was sort of on October 11th, 2018. She said it was her 17th surgery, her biggest surgery. And when she was interviewed in PACU, she said to me that it was the best she's ever felt after surgery.
Yeah, so for me, that patient was very special because I've known her for a long time. She's part of what we like to jokingly call my kids' college fund because we've done both hips, both knees, and I've taken care of her for, almost 15 years now. And when you first brought up the idea to me, again, I'm very much into trying to understand the whole avoiding opioids and something. And you said acupuncture, and I was like, cool. That sounds different, right? I have no idea. And I have to admit, I at the time knew very little about acupuncture. It wasn't something I'd ever studied or learned about. It's not something, as you know, any of us learn in medical school, but it sounded like a great idea. And in the PACU with that patient, the first time I was sold. And because I had done 2 other surgeries on her before, we've since done another since then, as you know, but I'd done 2 other surgeries on her before. And she told me flat out that was the best she ever felt waking up from an operation. So in my mind, either you were an incredible anesthesiologist, like much better than anyone I ever worked with, which turns out to be true, but that's later in the story.
True. Very kind.
Or there was something real to this. And look, we've been doing it now for 5 years. We've published multiple papers. We've treated together, I know you and I have treated thousands of patients together at this point. And it is, anyone who's not a believer, they just need to see it to believe it. The first patient, the second patient, the third patient that gets it, they'll never question it again.
Yeah, it's really amazing the response that we get sometimes. And Beth, you and I worked together just starting a few years ago, and I was really so happy that you were quick to support the intraoperative acupuncture for your patients. And we've had a number of patients together and apart, but there was one patient that I remember specifically because you, like a true millennial, started videoing this patient who was talking about, she had one knee with acupuncture and one knee without. And, she just sort of organically started talking about it. Do you remember?
Oh, yeah, absolutely. I did. So I did her knee with you first, and she had had the acupuncture, had a very easy, relatively easy, no total knee is easy, but relatively easy post-op course. And then 6 weeks later, we did her other side. And she did okay. But the first thing she said to me when I saw her in the follow-up was, yeah, I don't know what it is, but I did have acupuncture that first one, and I was less nauseous, and my swelling was better, and things that I don't think we can necessarily point her, exactly explain right now, but she immediately said there was a difference, and so of course, I whipped out my phone and got that on camera. So you're welcome.
And this happened to me yesterday. This is not a single incident.
No,
this is not something you don't hear. Yesterday, I walked into a patient room, and her words were, I am so angry with you. I said, oh my gosh, what happened? Now she had a total knee, so I just assumed it was because she hates her total knee, because lots of patients have a hard time in the beginning. And she goes, you told me we were going to do the same thing. The first side, everything was the same, but I had that acupuncture anesthesiologist. This time I didn't. She said the first 2.5 weeks were completely different this time. 6-8 weeks later, she was doing okay, and yesterday she was doing fine, but she was genuinely upset with me because she didn't get acupuncture with her second knee, and she said she could tell the difference in just her, general how she felt during that early recovery. And if I didn't have the couple thousand patients before her, I'd have just kind of blown it off. But I think it's really consistent. Just like Beth said, they can tell the difference.
Mm-hmm. Yeah, I think it's you get your total knee and you're going to be fine because we have fantastic surgeons here, all over the country. But I think it's those first couple of weeks of recovery and the perioperative experience that the acupuncture can actually really help with patients and their recovery and how they're feeling and their motivation to actually get up and work with physical therapy. So I think that's where we can really have an impact with this modality. And unfortunately, we just don't have enough people doing it yet that we can offer it to everybody. But we're hopefully getting there.
But I talk about this all the time, and Beth and I have talked about this. It's amazing, especially with things like total knees, surgeries that are really painful, that patients are really afraid of that surgery. And what they're afraid of is how much it's going to hurt later. And how they feel the moment they wake up completely changes their mental attitude moving forward for the rest of the recovery. So when they wake up in the recovery room, legitimately telling me, I feel like I never had an operation, they just feel like they never had anesthesia, immediately their entire outlook for the next 6 weeks is completely different than the patients who wake up in the recovery room nauseated, vomiting, in pain, and all of these things that we know, right? And I used to say we just think it, but you and I, we've got the data now. The three of us have published this data to show that they just feel better, and those anesthetic side effects are minimized in the acupuncture patients. And I think it sets them on a course that is very different than a patient who wakes up feeling like they just got run over by a truck.
Yeah, I totally agree. And I think the one thing that is difficult to study, and we're trying to figure this out, but that post-operative anxiety, like you touched on it, like they're very nervous about having the pain, and then it leads to an anxiety that's kind of a vicious cycle. They're anxious about the pain makes them more anxious, and if you can hit their anxiety early on, I think it makes a big difference too.
Yeah, I think it's funny, the protocol that I use actually was based on this protocol that's used in the military for PTSD. So pain being sort of this umbrella term for, the physical pain itself, actual nerves and cutting into the skin, but also pain catastrophizing, people with that anxiety around the fear that we were talking about earlier, really does amplify any actual physical pain that they're feeling. So this, I think it sort of empowers patients to, it's not just, oh, you have pain, I'm going to give you a pill. This is something that's actually going to help their whole system, allow them to feel calmer, to modulate the fear, to modulate the anxiety, and to modulate the pain itself, and really get them on the runway and ready to go for post-operative pain management, post-operative physical therapy, all sorts of things surrounding their surgery to really help them get through, what is quite a painful surgery, even though we like to tell patients that, we're going to manage your pain. It's not going to be that bad. Sometimes it can be, and so we want to do everything.
I tell them it's going to be bad.
Okay. Yeah, I tell them it's going to be terrible.
I try to tell them, yeah.
But I think this is the next phase, right? This is the next phase of understanding pain. The work that you've been doing for years, the work we're doing now, is all about there's more to treating pain than giving medication, right? Understanding how integrative medicine, understanding how anxiety, depression, fear affect it. And now when we're studying pain catastrophizing, when we're studying the impact of biofeedback, the impact of other non sort of medication-based modalities is really the next frontier in helping people deal with pain and minimizing the unnecessary use of medication. Now, some medication use is appropriate. I'm not trying to say that there's no place for pain medication. I just think pain medication is just a very, very small part of what we're ultimately going to learn is the way that we address pain, especially in patients having surgery. And I think the work you've done, the work that we're doing right now here at HSS is going to help lead that next step of where do we take pain research from here? Where do we take pain control from here?
Yeah, I think we're very good at optimizing patients physically for surgery. I think you're exactly right. We need to optimize people's, emotion and mentally for surgery. We're not very good at that yet, but hopefully this is one step to getting there. Beth, what do you tell patients who, request acupuncture or don't even know about the acupuncture when they go to the OR?
Yeah, I've started including it in my spiel when I describe the surgery. I say typically it's done with a spinal anesthetic, and then I do my orthopedic version of what spinal is, which I won't get into here. And then I say, if you're interested, I do tend to work with an anesthesiologist who does use medical acupuncture during the surgery. We have some data to show that it does improve your early outcomes and limits your pain, nausea. And I usually leave it at that. And then I say, if you have any additional questions, I'll direct them to my colleague who's more of an expert in it than me. Because I'm like, Dr. Ast here, I think we're big fans of it, but the truth is we're not the ones licensed to do it. So I like to leave anything, more than that to you.
Oh, well, I appreciate that because sometimes it's harder to reel back something than
that's been promised.
Correct.
Yeah.
Correct. What's their reaction usually?
Honestly, many people, the overwhelming majority of people are like, that's so cool. I definitely want that. Yeah, I would say 9 out of 10.
Yeah, patients love it. Like once
Yeah.
you mention it, and I think they love it because it kind of sounds cool. I think honestly they love it because many of our patients are searching for any answer that isn't surgery. So they've probably tried, or many of them have had acupuncture in the past. And whether they had good experiences or bad experiences from its efficacy for the treatment of pain related to arthritis, most of them had a good experience. I think acupuncture makes people feel pretty good. And even if it didn't necessarily, it's not going to treat their bone-on-bone knee arthritis. But I think they like the concept. And again, it all goes back to this concept of anxiety. I think more than anything, they love the fact that we're thinking of something different. They love that we have already acknowledged they're going to be afraid of this pain. This pain potentially could be bad. And we've got lots of different things we're going to do. We've got our anesthetic techniques. We've got our nerve blocks that we've talked about. We've got the medication that we will have available for them. And by the way, you've heard of all that stuff, but everybody does that. You're at HSS. We're doing something no one in the world is doing. And here's why we're taking that next step and understanding how to help you with your pain. And I think it's that above all else that they absolutely love hearing. Then they get it and they love it and that's great. But I think one of the reasons the patients generally have such a positive outlook on it is that they're really excited we're trying something new.
Yeah, I think that's the biggest sentiment that I get from all these patients that I see. They're like, HSS is so innovative. They're always trying something new, and acupuncture is not new per se.
Really?
It's kind of a little,
I heard about it 5 years ago.
Yeah, something like that. But and I tell them, I'm like, look, if you've had acupuncture before, we're not growing cartilage for you. Like, you need to have this surgery. It's not something where some people are like, oh, well, what if I go get acupuncture and then I don't need surgery? And I'm like, you don't have any cartilage. We're not working miracles here. Acupuncture isn't growing that cartilage for you. You need the surgery, but we can help you with a lot of other things. We can help you with range of motion. We can help you with the pain control. We can help you with the anxiety. And I think you're right. It's sort of an extra layer added to everything that they've already read that they haven't read about that really makes them feel like, oh, maybe this is something extra that can help me get through this really strange thing that I have to do to my body.
Yeah. I think that, we kind of touched on it earlier, but I think we don't think of that enough. Like what you said about optimizing people's mental health going into surgery. We do this every day. This is just Tuesday. This is Wednesday, Thursday, Friday for us. This is our everyday. But for somebody that's signed up for a total knee or total hip, that's one of the scariest days of their life. And I think because it's so routine for us, we do tend to forget that. And I think this is, just like you said, one extra thing to help calm them in that storm of a surgery day.
Yeah. I have some patients who ask me, hey, I really like the acupuncture. When do you think I can get acupuncture after surgery? And I typically tell them, you don't actually have to have acupuncture at the site of the surgery, like at the site of the knee or the hip, or wherever you're getting surgery. That, body points are also very, very, very good. But what would you recommend, if they wanted to have just a little bit extra amp? How many weeks out from the surgery would you say?
Yeah, so I actually have started to try to really figure out an answer to this question because as the program has grown, I've been starting to get referrals from outside acupuncturists. Yeah. So now in Northern Jersey, if you're an acupuncturist, oftentimes you're sending patients to me because they want them to continue their acupuncture treatment in the operating room, and they just love the concept of this. They love the idea. I operated on one of the very popular acupuncturist's father in our area. Luckily, because you were there, he did well. So we've gotten a big thing, and they always ask me the same question, like, how long? My answer is, I don't really know, but I really don't like anything near a knee for at least 6 weeks, and probably more like dental work, like for 3 months, just stay away from it. And it's just like dental work, right? I don't actually have any data to support that you should wait 3 months to get your teeth cleaned, but I still tell everybody that. Yeah. So I tell people, if you can't wait at all, like 6 weeks is the least amount of time. And even then, like, keep it high up on the thigh. Like the leg is okay, the knee is not.
Yeah.
But like all other interventions with absolutely no science behind it, I tell people 3 months.
Yeah, I would agree with that. And so part of this experience is I've actually tried acupuncture. Steph has treated, Dr. Cheng here has treated me, and it's definitely informed what I tell people too, because I had no idea what it was like until I experienced it. And, you know, if you're getting muscular acupuncture, it's no joke. Like they can dial it up, and so I think
that's the beast. So
having the muscles be recovered from surgery, which I would argue, 3 months is probably when your muscles start to really calm down. People can feel a lot better earlier than that, but they did have a trauma to their extremity with the surgery, and so I think introducing what you do with acupuncture into those muscles is probably too soon in the immediate vicinity of your surgery until you're about 3 months out.
Yeah. So I use a lot of electricity, which is what Beth was talking about in terms of, you know, contraction of the muscle. But a lot of acupuncturists out in the community do a very neutral technique, so without the electrical stimulation. But okay, good. I'm glad, because what I tell patients is, I was like, you know, I always defer to the surgeon, because the last thing we want to do is introduce, you know, pain you can deal with. If we introduce some sort of bug into that brand new knee, that's going to have a whole other can of worms that we're going to be opening. So stay away from it, and then talk to your surgeon. See what they say. Much
like we don't teach them about acupuncture, you let us handle the surgery part, and everybody's
exactly. Yeah. Any other anecdotes that we have about patients? We had that one patient who was scared of needles, period.
Oh, we've had a couple, but we had one who was extremely, extremely needle phobic. And so this happens in time to time. We have patients that need to really be sedated before they can even have their surgery because of needle phobia. And I remember you had mentioned to her in the holding area, like, yeah, we're going to be doing this acupuncture. Yeah. And she was fine with it as long as she was asleep.
Right.
And we were very worried that she was going to have significant postoperative anxiety. She had to have the IV stay in after surgery. That's routine. That's, you know, safety first. And she was totally relaxed when she woke up with the IV in her. And that's somebody who had a lifelong, not talking about a mild phobia. This was a significant phobia. And so I think without the acupuncture, who knows if she would have been able to tolerate it.
And again, we've published our studies on this, right, on patients with severe hospital phobias. Yes. We've got multiple patients with severe hospital PTSD, or what they call nosocomophobia. And we had that one particular patient who had horrific AVN of both of her hips and had canceled her surgery on the day of surgery 3 different times at other institutions because she just could not bring herself to walk into the building. It had nothing to do with the OR. She couldn't get in the building. Yeah. The one time she made it to the pre-op area, they canceled her because her blood pressure was systolic over 200. She was legitimately just having a terrible panic attack. And she had her first hip with us, and in the recovery room opened her eyes and could not believe that she had gone through with it, did it, and said she felt so good. I mean, we did the other one, 6 weeks later?
Yeah.
I've seen her back now. This is at least a year ago, if not more. And she, to this day, was like, I can't thank your team enough. There was no other time in my life I was ever able to walk into a hospital and not have an absolute panic attack. But the acupuncture, number one, I think the idea that we would use acupuncture, but number two, the actual effects of it and how she felt when she woke up in a calm and relaxed environment completely changed her life and completely changed her ability to go through that surgery, which has let her get back to everything. I mean, she's back to complete, full normal activities, things she hadn't done in a decade, and she 100% credits the acupuncture, and so do I. I mean, there's no way that patient would have made it in that OR without it.
Yeah, I mean, nosocomophobia is like a version of PTSD specific to hospitals, and again, the protocol that we use in the operating room is based on a PTSD protocol that was used in the military. So all of this really combined, I think we've confined a segment of the population that can't walk into the hospital, like you said, with that patient, or into the OR, or even have a milder form of that. It would actually be really helpful for all these patients to be able to improve their quality of life by having a surgery, but being able to do it in a way that, you know, they're calm about it, they feel a little bit more in control because we have this particular skill set that we're able to perform this modality for them.
And it doesn't, and for years you and I talked about this as anecdotes, right? We talked about this as individual stories, but it's not just anecdotes anymore. We've actually got published data now, right? So we're here talking about the intersection of science and care, right? We've got published data on over 300 knee replacement patients showing a 60% decrease in opioid usage over the first 90 days, and not one acupuncture patient still taking opioids after 30 days. Right? We have our prospective randomized trial going on hip replacement right now. And we know
so many. There's so many patients.
We have to do a lot, right? We have to do a lot of cases in order to do an RCT on hip replacement pain, because hip replacements don't hurt that much.
Right.
But even that, when you start to look at some of our early data, is remarkable. Yeah. Remarkable. And I have patients coming in like, I think I had it, I think I didn't.
Yeah.
And ones that had both hips done during the surgery have said, I had it the first time, I didn't the second, or I didn't have it the first time, I had it the second, because I felt different. So I do want people listening to recognize, like, it's great to hear these stories, but we don't want people to think this is just stories of Eastern medicine that we're all like sort of believers in. Like, the data's there, it's real. And when we put out that first paper, I was shocked. If they weren't my patients, I would never have believed the results. The incidence of postoperative nausea, vomiting, the incidence of postoperative pain, and the maximum postoperative pain, and the opioid usage was better than any other intervention I've ever studied. And I've spent the last 10 years studying opioids after surgery.
Yeah.
I mean, it was absolutely remarkable. So anybody listening, check out that paper. If you're not a believer on a couple of stories and you love that term of like the plural of anecdotes isn't data, right? like this is data, this is real data, and please take a look at it, because it will absolutely convince you.
Yeah, so we had a 65% rate of patients who took less than 112.5 oral morphine equivalents of oxycodone or less from day 0 all the way out to day 30, whereas in the past it was 9%. So it was a pretty significant jump there.
I was just going to mention, I think another testament to this is how many anesthesiologists at HSS have started doing this. I think we've got multiple now that have been trained in some way by you, or some have adapted the technique. So you kind of know, in surgery at least, when something works, other people start doing it, and you can see that here too.
Yeah, it's been really great. It's been really fulfilling too. Like, I never really thought that this is where my career would go, and this would be the type of thing that I would actually be doing on a daily basis. But it's really been on a personal level, it's like having patients being so thankful for something that I'm able to provide for them, in addition to getting them through surgery and everything. It's been really I don't even know the right word to say, but heartwarming. I don't know, maybe something like that.
And it reminds you the importance of the team, right? And I think for all the surgeons out there, it reminds you the importance of having a good team, but also being a teammate with your anesthesiologist and with the rest of your team, right? Because it's not just the surgeon taking care of everything. It's not just the nurses taking care of, right? It is a team effort. And when you integrate the unique things that your anesthesiologist can bring to the table, you make care better, right? I can't do acupuncture for a variety of reasons. Mostly I don't really understand that much about it. But but I can partner with the right people that are bringing better outcomes to my patients. And I think across the board, that's a good message for everyone, right? The treatment of pain, the treatment of anxiety, the optimization of patients is not on any one singular person. It shows how valuable it can be to have a great team together, working together and listening to each other, right? The anesthesiologist shouldn't blow off what the surgeon says, and the surgeon shouldn't blow off what the anesthesiologist
100%,
says, right?
Yeah.
You brought this to me and I was like, sure, I don't quite understand it, but I'll try it, because if it has a chance to help my patients, that's what matters to me in the end of the day. And Beth had the same response. You're like, I don't know, I'd never had acupuncture before, but sure, that sounds cool.
Now
right?
I'm all in.
Right? And now not only for your patients, even for yourself, right? You really start to understand the power of some of these other methods of taking care of patients. And I think that partnership, that mentality that everyone is really there to make sure we're doing everything we can to improve patient care from start to finish, really does lead to a better experience for the patients and honestly just a better outcome.
Yeah, I think that is an excellent point, and something that we've all worked at multiple institutions over the course of our training and careers, and I think that's so unique to HSS. is how collaborative we are.
Yeah.
I was like, oh, anesthesiologists and surgeons are friends here, you know? And that's not the case at every hospital. I mean, I think that's really unique in that we are a team. And the surgeons acknowledge that, we meet the patient first and we bring them in, but we are only a small piece of this, and that, from surgery, anesthesiology, the nursing staff, everybody in the room, we really all do have that singular mission. And we like each other. Yeah. So it's great.
I mean, working with you both has been a complete dream of mine, and I can't thank you enough for really putting your trust in this modality and bringing this to as many patients as we absolutely can.
Well, and I know you've been traveling lately at other institutions. I know you've been giving grand rounds at a bunch of places, and I think that's great, right? The more we can get this message out, the more we can get people comfortable with this, the more patients who will be helped in a new and exciting and innovative way, right? And that's the point, right? That's the greater impact you can have than just a singular patient by patient impact, which is also super exciting and great.
Now we just got everybody excited about acupuncture. Yeah. There are some, I mean, it's rare, but there are some times where you can't do it on patients, right?
Correct.
You want to mention that so we don't have to be the bearers of bad news.
Yeah. There's sometimes where we're not sure if under general anesthesia, because usually with the limb surgeries, it's done under spinal anesthesia, your brain just works a little bit different under general anesthesia. We don't know if that means that there's any sort of difference in response, but I just tend not to offer it for those. And then patients who obviously have nickel allergies or things like that to the actual needle itself. But yeah, so we can offer it to the majority of people, I guess.
Overwhelming majority.
Yeah. But guys, this has been great talking to you. Thank you so much for joining us today. And thank you all out there for listening. And if you have any questions, we're available for answers.
Thanks so much for having us.
Thanks.
Yeah. Welcome.
Thank you for listening to this podcast episode from HSS Presents, a ConveyMed production. And keep listening to HSS Presents for other offerings. The views expressed on this podcast are those of the interviewers and interviewees alone and do not reflect the views of HSS. Information relayed on the podcast is for informational and educational purposes. This information is not medical advice and should not be used for diagnosis or treatment. Listeners should seek advice from a licensed medical professional before making any personal healthcare decisions.